Well, Living Upstate is here at Interim Healthcare at their Greenville office. I'm here with James Yarborough. We have some exciting news, James, that you guys are starting a new telehealth program. Good to see you.
You too. Thank you for coming.
Yeah, thank you for having us here. We've talked a lot about Interim Healthcare and all the different programs that you guys do, from in-home care to hospice to this telehealth program. First of all, tell us, what is telehealth for people that may not know what it is?
So beginning next month, we are going to be moving forward with telehealth and telemedicine, and what that is putting equipment in our patients' homes where they can monitor their vital signs and connect to our nurses and have that peace of mind. We saw through the pandemic where the ability to have that face-to-face connection with your providers, with your nurses, with your therapy team, we know was disrupted. There was a disconnect there.
And I love your background too, because you're in the technical side right now, but you are a nurse by training as well. So you understand how important that is to be able to have that access when you need it, and how transportation and different things can really be a barrier to folks that may not have access to medical care. This kind of takes it away because people have connection. They have a computer, they have a laptop, they have the things that you guys are going to put inside their home to be connected at all times to those caregivers.
When I started nursing many years ago, we did not have all the advancements that are out there now. So it's a true benefit to be able to log onto a computer, connect right to that patient in their home, and monitor, provide guidance and education. And not just that, the equipment itself does have some built-in features that the patient's going to be able to use without the nurse.
So let's talk about some of the things that you guys are able to diagnose using this equipment. What are some of the things that we will be able to monitor?
Our nurses are able to use the equipment to follow that patient, get alerts. We'll have alerts that are going to be sent via email notification that'll come right to our nurses, and if there's a need to communicate with that patient's provider, the nurses will do that. So we can monitor heart rate, we can monitor the O2 saturation, that's your oxygen, how well your oxygen is being moved around your body, blood pressure as well, and weight. So we know that with a select group of patients, those things are important to get out in front of early. If there's a slight change in weight, we want to know about it. If your O2 saturation is not where we want it to be, we want to know about it, and that way we can provide some interventions. There are a lot of things that we can do via video conferencing to educate the patient and make some subtle changes that can have a huge impact.
So James, obviously I know that you guys obviously deal with the caregivers a lot of times, the families of those that are needing the care. How will this be used and make their lives easier, and maybe easier to document all of this information?
Well, that's right. There is an optional app where our caregivers can actually download, and our nurses can walk them through how that works, and it allows our caregivers to walk through the patient's journey as well, making sure that they are recording their diagnostics. It will alert right there on the app. It allows that family member that's designated by the patient, because we want to make sure that we're HIPAA compliant, right?
Yes,
so we,
sure.
With the patient's consent, they are able to connect a family member to walk them through and stay connected with their journey.
And so one of the questions folks may have is, what is the eligibility? Like, who's eligible for these?
Yeah, that's a great question. So we're going to follow all of our home health eligibility requirements. There's going to be no changes there. Every home health patient is going to be eligible for telehealth. That's something that we have always provided, and we will continue to provide here at Interim.
And I know here at Interim you guys are so passionate about being able to operate with compassion, and the nurses are able to do that. This is just another tool to help you guys do that. That's
right. We really want to equip our nurses out in the field with all the tools that are readily and available, and this is one that we know that giving a nurse the ability to connect with a patient is going to have a huge impact.
And that's on the nursing side, and for the patient, having control over your health and being able to be connected to the folks that are making sure that you're okay is invaluable.
We are empowering our patients with education, so there's going to be some educational materials that are preloaded on our tablets, and their care plans that are identified, that are disease specific. We know that it's not a one size fits all. Our patients, they deserve and they want to have some individualized care.
Well, you guys do such a great job of it, and I'm sure folks that are watching this are probably interested in ways that they can learn more about the telehealth program and find out how they can get started on that journey. What is the best way for them to find all of that information?
Well, that's great. They can reach our website. I'm sure we'll have that posted here for you as well. You know, talk to your providers. You know, make sure that you're a physician. If you are qualified for telehealth and for home health, that you're asking to come to Interim.
And we always love talking about this wall because it really shows that it's such a great place to work. And you guys have a great boss and a great system, a great culture of working here. That website is on your address, and we'll be sure to put this full article at our website, livingupstatesc.com. James, thank you so much for having us in today. Thank you guys for all the work that you do. We appreciate it.
Absolutely. Thank you.